Hi, in this video I'm going to be talking about what to expect with breast reconstruction. What is breast reconstruction? What are the different types? What are the complications? And what about the recovery time? Breast reconstruction is when surgeons, generally plastic surgeons or specially trained breast surgeons, reconstruct or reshape the breast, generally after mastectomy, but also even after partial mastectomy if you're not happy with the appearance of the breast. Breast reconstruction is based on your personal preference. Nobody has to have reconstruction. Some people feel pressured to do so because their friends or family or partners say, "How can you not have a breast after a mastectomy?" This is your choice. And breast reconstruction surgery is yet another procedure. It lengthens the time you're in the operating room, and you may not have a relationship with your breast or breasts that makes you want reconstruction, but many people do. It helps them feel as normal as possible. They want to look normal under their clothes. There are other ways to do this with prostheses, etc. But for some people, it's really important that they look as normal as possible, not just to themselves, but to others. So there are lots of reasons to do it. Some people who have a breast that's so small they need a mastectomy can't find a prosthesis small enough, and they will actually choose to have bilateral mastectomy with reconstruction. It's hard to find a swimsuit to wear, for example, if you're very small-breasted. So there are lots of reasons why people do it. There's no age limit on reconstruction. So even if you consider yourself elderly, you can have reconstruction. And no matter how young you are, you can have reconstruction. If you've had breast implants before, you can have reconstruction. It's important that you meet with a plastic surgeon early on. So if not right at the time of your initial surgery consultation, at some point fairly soon, so you know what to expect and so they can give you advice on the best type of reconstruction for you. So I'm going to talk about the types right now. There are two main types. There's implant reconstruction. Implant reconstructions are done by inserting a tissue expander. This is a temporary, sort of like a balloon that gets inflated every week or so with saline to stretch the skin. And then that implant is removed at another surgery and a permanent implant is put in. That could be silicone or saline. We have talked about these in other videos, but I just wanted to give you an overview. So there are different types of implants that you can have. And you can have autologous or flap reconstruction. That's where the surgeon will take tissue from your abdomen, your buttocks, your back to reconstruct your breast. Some people will have both of the buttocks operated on so that there's symmetry in the buttocks. You can have both breasts reconstructed after bilateral mastectomy if you have enough of your own tissue, or you may have bilateral implant reconstruction. There's also a combination where we can use your own tissue and then also implant to get you the best results. And if you're not happy after your first procedure, it is totally acceptable to go back for a revision. Insurance will cover breast reconstruction in the vast majority of cases, but this is something you'll want to be sure about before you proceed with breast reconstruction. Next time we're going to be talking about the timing of reconstruction. There's immediate reconstruction and delayed reconstruction. Immediate reconstruction is done at the time of your primary breast surgery. So you have a mastectomy in the operating room and the breast reconstruction is done at the same time. Delayed is you have the primary tumor removed, whether it's a lumpectomy or a mastectomy, which is generally the situation in which people have reconstruction. And then afterwards, you have reconstruction. Now, the reasons you might want to delay are because you're going to have radiation therapy. And radiation therapy is best done with as little breast tissue as possible. If you have radiation therapy to an implant reconstruction, that whole capsule that the implant sits within can get very tight and it can constrict. And that can be both uncomfortable and also not as cosmetically appealing to you. If we do radiation after autologous reconstruction, the breast can get smaller. Radiation generally leads at first to some swelling and inflammation, but later fibrosis. So the breast will get smaller, and if you've had one side done, you'll have more asymmetry than perhaps you had wanted. So when radiation will be given, we generally recommend delayed reconstruction. I have had people who did not know they were getting radiation, who had an implant in place, and when they went to have radiation, they had the implant removed, then radiation, and then they started over again. So I want to talk about the two different types of surgery in terms of timing, because as I mentioned, with an implant reconstruction every week, the saline is added and the tissue is expanded, and then there's the exchange, it's called, when the saline expander comes out and the permanent implant goes in. The autologous reconstruction is one big procedure, and you'll be in the operating room for a much longer period of time, but then you're sort of done, except for minor revisions, and of course there's nipple areola reconstruction, which we've covered in another video, which we'll link to right here. So some people want to just have everything done at once. That's autologous. The implant is a little less of a prolonged surgery, but it's extended over more time. So those are two things to consider. And then finally, what's the recovery time like? In general, the recovery time is shorter with implant reconstruction. That's not the case for everybody. If you have a complication like an infection and the implant needs to be exchanged because there's been an infection, obviously the recovery time will be longer. With autologous reconstruction, where we use, for example, your abdominal tissue or your buttocks or the tissue on your back, we actually don't want you driving for quite a while because of all those other areas need to heal, and the healing can actually be longer for the abdominal incision or the incision on the buttock than it is for the breast incision. So those are some things to think about, and I would recommend you speak with your medical team about what they recommend in terms of how long you'll be away from work or your daily activities. What they tell you may be a little shorter than the actual fact. So yes, you can go back to work after 2 weeks, but I generally recommend adding another week to that because of fatigue. I also recommend going back on a Wednesday. If you work a Monday through Friday day, go back midweek so that you have a shorter week. It's something I learned during my own maternity leave. Oh, can you get pregnant after autologous reconstruction? You can. People can, after tissue's been removed from the abdomen, they can have a later pregnancy. That's a question we often get asked. I've covered a lot in this video. I hope it's been helpful. Click subscribe and like, and you can drop a comment or question below. Let us know how your experience has been. How long did recovery take for you? As always, you can go to yerbba.com to get your personalized report.